Because what is happening, the trend nowadays, I mean, because increasing divorce rates, a lot of people are going for the second marriages, and so sometimes they want to present themselves as fresh. So they want to feel good about themselves. So do you suggest any of these procedures for them? For the people who are actually...
So we have a combination therapy, vaginal tightening and hymenoplasty. Hymenoplasty is a minor surgical procedure. It is done OPD based. As such, there is a no downtime, very minimum pain, and it's a 30 minutes procedure.
Where it is hymen tags will be resutured, you mean?
Yes.
Okay. So you can combine with any perineal muscle repair, perineoplasty, right? Something like that?
No, we don't do. It is a very thin tissue.
Okay, in hymenoplasty, you mean to say?
In hymenoplasty.
So hymenoplasty is also called revirgination procedure, and it is a very old procedure actually, but it is done in certain religions, because a lot of taboo is there. So because people, when they want meeting first time, so people need to bleed. I think still certain tribes and certain cults in India still expect that the bleeding has to happen in the first time intercourse. So for those people, generally it is hymenoplasty has no functional benefit though. So we don't suggest hymenoplasty for anyone who wants to get it just like that. So it is only useful, or probably there's no actually functional use for this. This is only to feel the partner happy, or to at least to follow the conditions of the social conditions or whatever it is. So otherwise
we can see it in sports people also who does like a lot of cycling, swimming.
So the hymenal tears are very normal, so it doesn't need to necessarily that they already underwent any physical interactions. So even with the general just sports, yoga, stretches also, hymen can get torn. Right, doctor. So coming to the aesthetics. So now all we spoke is about functioning. So tightening of the vagina, how to be done. We discussed home-based remedies. So we discussed non-invasive measures, and we discussed surgical options also. And sometimes if the repeated use of multiple deliveries, the area of the vagina get little loosen, and the tissue also get little disorganized and unaesthetic appearance. So do you have any procedure of choices further to improvise the whole situation there?
Yes, we do have like a lot of options nowadays. Externally, there is surgical procedures mainly, which is labia minoroplasty, in which we will excise the excessive tissue, which is the empty tissue which is present. A lot of people will come with the complaints of camel toe appearance, where females wear pants and they can see that cuts over that area where they feel very uncomfortable. And some people might feel like that rubbing kind of a issue whenever they're walking, and patients who have a lot of tissue over there, they have a recurrent infections also. So when they have that kind of issues, they can come and consult a doctor here, and in which we will explain how we can proceed through excisions. There's different types of procedures in that. According to the patient's requirement, we can proceed with the surgery. So
all these procedures are daycare procedures?
Yes, all these procedures are daycare procedures.
Usually how much is the downtime patient should expect it?
As such, it's just a hour procedure. Patient can come in. It is done either, it depends upon the patient pain tolerance also. If the patient has very less pain tolerance, we can get it done short general anesthesia, and if the patient is able to handle it, we can do it under a local anesthesia, and we can excise the tissue, and we can suture it, and we can send the patient. We'll ask the patient to come after 7 days, but the recovery will take minimum 25 days for the tissue to heal.
So do you also improve the labia majora, which is outside the area?
People
who lost weight loss or post-bariatric procedures, people have the loosening of the whole area, and they'll especially complain that it is not looking aesthetic, especially in the labia majora part.
People mainly come with this kind of complaints when they lose a lot of weight, and mostly postmenopausal females also, because when we hit puberty, there's a lot of fat deposition over that area. That decreases drastically, and that skin becomes loose or baggy, and we have a combination procedures for that. One is non-surgical radiofrequency, in which first we will see how much extra tissue is present, and we will tighten that area with a combination therapy of radiofrequency, PRP. Then if still there is a lot of space inside, we will go for fat fillers or synthetic fillers, derma fillers, and depending upon that, still they are not satisfied, like we can go for surgical procedures.
So this is coming to aesthetic part. To brief it up, so there are two components in vagina. One is the labia minora, which is inner side of it, labia majora, which is outside of it. So labia minora can reshape with multiple surgical processes, as doctor explained, and labia majora, which is outside area of the vagina, which can be aesthetically improved with non-surgical devices like RF and PRP. If it doesn't get improved, and it can be improvised with dermal fillers or fat grafting, which is taken from the patient's own body fat. And by this, we can externally make that whole area much better. It looks more aesthetic. And thank you so much. And probably we'll continue the talks in detailing in each procedures in further topics. Thank you so much.